today we're going to be doing our deltoid repair, and we're looking at the medial aspect of the ankle. I like to mark out our landmarks first. So you just mark along the anterior and posterior and inferior border of the tibia here. And most commonly you're going to see the superficial deltoid torn at the anterior mid portion. So we'll kind of split the medial malleolus, bisect it, and make our incision in that trajectory there. And kind of taper it a little anteriorly with your incision there. So when doing your deltoid repair in the setting of an ankle fracture, I feel strongly that it's important to really assess the integrity of both the superficial and deep components. If you do an arthroscopy ahead of time, that allows you to really evaluate that in more direct fashion. Oftentimes you'll see at least the superficial deltoid torn and oftentimes the deep deltoid. When doing the repair of the superficial deltoid, I'll oftentimes use two 2.5 millimeter anchors, with the first one placed at the inferior portion of the medial malleolus and the second one placed at the anterior superior portion of the medial malleolus, and do essentially a medial rostrum during the repair construct. In the Ossio 2.5 millimeter anchor kit, there is a 2.0 millimeter drill bit, which we'll be using today, but also available is a 1.8 millimeter drill bit for less hard bone. So we'll place the drill guide against the desired location and drill through a hard stock. I prefer to cycle it a couple of times to clean out that canal in which you drilled. So while leaving the drill guide in the right position here, we'll then place the anchor in with the sutures facing towards the outlet there, and then just gently mallet it down. Where the black line is buried. And you pull the tab in the back, pull it out nice and smoothly there, and then there you go. So the first anchor has been placed. And just to kind of show you the pull-out strength here, you can lift it up and you can really see how much strength. Okay, so now we have both anchors placed. So we'll begin our medial rostrum here. So I like to pass my first needle deep into the deltoid there. And then the second one, I like to do deep to superficial. And then back down again, and then creating a rip stop by going behind that last one there, just to give it a little more effective strength there. You can see how it looks there. So we've done 4 passes with the 2 sutures, one of each of the strands having a rip stop construct. And you can see how, as we pull the deltoid back up, how it nicely cinches down to the medial malleolus there. So with the ankle in neutral position there, we'll just tie our square knots here. And then sometimes what I'll do is I'll then just back up that construct by bringing that suture through the remaining soft tissue just to kind of close that down there. You can see how that nicely cinches down that construct there. But at this point you've already done your deltoid repair. This is just backing up a little further. So another option is just to take the edge of the remaining tissue and just sew it up onto the cuff left over on the medial malleolus. And this allows you to just further tighten down your repair construct here. Like so. And you can cinch this down if you wanted to. And then what I'll do finally, after all my knots have been tied, is I'll then just advance the retinaculum to just cover your knot stacks at the very end. So at this point, you've now completed your deltoid repair utilizing the Ossio 2.5 millimeter suture anchors.